Hey ladies, I'm back. Okay, so let's talk about IVF protocols. Okay, so apparently there are different kinds of IVF to start with, right? So there are two websites that I'm using. I will link them down in the description so that you can read up on them as well. One is New Hope Fertility Center, and this one is saying there's conventional IVF, which is a fresh conventional IVF cycle entails the stimulation of multiple egg follicle growth, 15 to 20 through large doses through large doses of injectable fertility medications. When the mature stage has been reached, the eggs are then surgically retrieved and fertilized in vitro in a lab. One or two of the resulting embryos are then transferred into the woman's uterus that is, for implantation into her uterine lining. Excess embryos are typically cryopreserved. So that's fresh. What is wrong with my brain today? Probably because I have not eaten yet and it's 1 o'clock. I gotta get better at this. Anyway, that's a fresh embryo transfer versus a frozen embryo transfer. Then you have what's called mini IVF. And mini IVF is lower dosages of fertility medications are prescribed to produce only 3 to 5 high-quality eggs. And then the patient's cost per cycle is reduced because there's less medicines. And then the physical discomfort that the patient feels is lessened because you're not forced into producing a whole bunch of eggs, which 1, weighs down your ovaries, 2, forces them to be bigger than they usually would get, and 3, they just feel heavy or sometimes painful. I mean, I don't know what it feels like personally, but watching a lot of IVF ladies out there, they often complain of discomfort and bloating and all that great stuff. So mini IVF is a way to lessen those because you're aiming for less eggs. Then you have what's called a natural cycle IVF, and that is almost completely drug-free. The woman's body may need only a little coaxing to achieve a pregnancy with her 1 high-quality egg produced during a natural menstrual cycle, and then her single natural egg is the very best a woman can produce without the need for numerous costly, painful, self-administered fertility medication injections. Kind of sounds like an IUI to me, I guess. Why would it be IVF? I guess they take the 1 egg out. It doesn't say here, but that's what I'm guessing. But why go through all that to just take 1 egg out? Anyway, there's also something called in vitro maturation, which is IVF/M, and that is egg maturation in vitro. So it's a revolutionary method of assisted reproductive technology, helping to increase a woman's chances of using at least some of her immature eggs for fertilization. IVM, I guess, in vitro maturation, is innovative. That is a technique that surgically retrieves. There's a gnat in here. My gosh. IVM is an innovative art technique that surgically retrieves a woman's eggs while they're still in the immature stage. And the woman's eggs can be matured in a controlled laboratory setting, which is in vitro. So, those are like different kinds of IVF. So then when you're going to do IVF, there are different protocols as well. So there are 3 main protocols. So one protocol is the luteolupron protocol, also called the long lupron or agonist downregulation. And that protocol is the most commonly used IVF protocol in the U.S. or it used to be. It used to be. Now the antagonist is the most kind. That's the second one that we'll talk about. This is where Lupron is used for down regulation. So what this is, you start Lupron 7 days before your next expected period. This is called mid-luteal timing, right? Then an FSH drug is started within the first 2 to 7 days after the period begins. And then leuprolide acetate dose is often reduced when the FSH product is started. The dose and brand name of the FSH product could be Follistim, Gonal-F, Menopur, varies according to the preferences of the physician and the patient stimulation. Most women get a starting dose between 150 and 375 units of FSH product per day, and then the dose is adjusted as the stimulation progresses. So that's the long protocol. The next one, the next protocol is the antagonist protocol that involves gonadotropins. Am I saying that right? I don't know. Antagonist medications. So there's agonist medications and then there's antagonist medications. So the antagonist protocols, the most commonly used, is that said recently, the agonist or the long Lupron used to be the most commonly used one, but this one is the most commonly used. So this protocol is use agonist medicines, so gonadotropin releasing hormone agonist or Lupron, or ganirelix antagonist to suppress the LH surge and ovulation until the follicles are mature. Then FSH product, follicle stimulating hormone product, is used to stimulate the development of multiple follicles. And then an HCG, a human chorionic gonadotropin, is used to cause the final maturation of the eggs. So that's basically the 3 steps to that protocol. And there's some more information on what those drugs are. The third protocol is flare and microflare protocols. These are also called short Lupron protocols. And short protocols are used for patients expected to have a low response to ovarian stimulation. So how this works is the Lupron is started on cycle day 2 in the same menstrual cycle that will retrieve the eggs, instead of starting it the week prior to the start with the long Lupron. Then they try to take advantage of the initial flare-up response of FSH and LH release from the woman's own pituitary gland that usually occurs in the first 3 days of the agonist administration. So continuing Lupron for more than 3 days temporarily suppresses the pituitary gland so that it has a low output of FSH and LH. The FSH product, Follistim or Gonal-F, is started on the following day, which is day 3. The idea is that Lupron will stimulate the release of a large amount of FSH and LH, and that will jumpstart a flare-up the follicles so that they might have a better ovarian stimulation with more mature follicles and eggs. Birth control pills are usually given for the month before the flare so that there'll be no leftover cyst or corpus luteum that could become reactivated by the high LH levels on the onset of the flare submission. So again, I will link the page. These protocols are on the advancedfertility.com link. There's a lot of information. I think this is a fertility clinic, but their website has a lot of good information on like IVF, flare, microflare, the different protocols, all that great stuff. So now, as I mentioned before, when I did my consult with my RE, I'm on an antagonist protocol. I have my meds here. I haven't even opened the box yet. And I have my instructions. So we'll go through the instructions and I'll pull out the meds. Okay? Okay. Alright. Got my scissors here. Get this box open, especially since some of this has to be refrigerated. So I want to make sure that I get in here and take care of that. Okay, so I got the box open. This is so exciting. It's like Christmas, only I never celebrated Christmas, so I don't know what that's like. All right, so my pharmacy is Freedom Fertility, and they give a ton of instructions. So I've taken both Menopur and Gonal F before, so I know all about reconstituting and self-administrating. This one is for the Cetrotide, and then, you know, there's all this documentation about my rights and all that good stuff. Okay? All right. So also, I had them send me another Sharps container. In the Sharps container, they gave me more gauze and alcohol pads, which I didn't need any more of this, but I do need another Sharps container, especially since this is a lot more needles. Okay, so we've got quite a few things here. Now, let me tell you, because I have a bill here. Alright, so we got some needles. These are some short needles. These are the 27 gauge half-inch needles. I guess he prescribed the needles too. Okay. Here's a mixing needle. The 25 gauge 1.5 inch needle. I'm sure to be used with something. There's some more instructions on how to use the Gonal F pen. Again, they're really big on the instructions at Freedom Fertility. My insurance kicked in for all of these meds. So the grand total of all of my meds, as far as my copay is concerned, because a lot of like $30, $10. The grand total for my meds for this cycle, I'm just going to put it up here now, is $173.18. So, not bad. Not bad at all. I've got 3 meds here that were a $30 copay, 1 med that's a $50 copay, 3 meds that were absolutely free, 2 that were $10, 1 that was $9.19, and 1 that is $3.99. And I know for a fact that the $3.99 one is the volume that he prescribed. My insurance does not cover 1 tablet of volume, so I had to pay for that cash. But it was only $3.99, so not bad, not bad. So looks like my Cetrotide was $30. My doxycycline was $30. The Gonal F was $30. The Menopur was $50. Let's see. The syringe. Oh, the syringe. That was free. All my syringes were free. Those were the 3 things that were free. My needles. Okay, and then prednisolone was $9.19. Chorionic gonad, that's the Pregno. That is my trigger shot. That was $10. My progesterone is $10. He gave me prescriptions for a transfer as well. So the progesterone is $10. The diazepam, that's the volume, 1 tablet, $3.99. Okay. So that was all of this. Okay. Hold on to my receipts. All right. Not bad for 10 days worth of medicines. $100 and some odd dollars. Okay. But considering a lot of women, even with a 50% discount for IVF cycles, I was just talking to Baby Badgie. on Instagram. I'll put her name down here, and she was telling me she had a 50% reduction in the cost of her meds. She was self-pay, and it still cost her like $4,000 just for her meds. So I am incredibly blessed. So right now I only see 2 needles. There is I've got some refills on these. So that's interesting. I have to organize this and figure out when I'm supposed to use these. Okay. So let's talk about my instructions. All right. So first thing, I was supposed to take birth control, only active birth control pills until 5/28. That was Memorial Day. I did that. It also said that I should have been taking 1 prenatal vitamin, which of course I've been taking for over the past year. And a baby aspirin, 81 milligrams tablet daily. I have not been taking baby aspirin because he did not tell me to take baby aspirin. So I have to start my baby aspirin tonight. Okay. So next it says I'll report to the office on June 5th. That was today for my pelvic ultrasound. I didn't get these till today. So, you know. If everything looks fine, you'll start with injections of Gonal F on June 6th. Medication is injected subcutaneously. That's in the abdomen twice a day between 6 and 8 a.m. and 6 and 8 p.m. Okay, so the Gonal F is a refrigerated med. So that's in this big thing here. It's cold. So it's cold and it's a little wet. I have to keep track of the time because my blood work that I have to get done today is scheduled for 2:30, so it's 1:19, and I'm trying to make sure I'm not late for it. Okay. So some ice packs here and a bunch of blue bags. Alright, so here's the first blue bag. And this has the box of Gonal F, and it's actually got some Cetrotide. Okay. Alright, so I will open this up and show you what it looks like. I'm sure I've shown you the Gonal F pen again. My IUI 3 video. Where I showed you what that cycle looked like with my injections. I was taking Gonal F during that cycle, so I did use the pen there. You can check out that video. So basically, you have the pen and you have the needles, and so basically, you take the pen. I'm just gonna open it. You screw the needle on. You know, there's no air or anything in here. You want to make sure there's a little bubble in there, but I think that's okay. And it has a dial. You dial it up, dial it down. So basically, I am to take 150 IUs of Gonal F. So with the needle on, put it in the belly, press it in, all that great stuff. Like I said, you know, you can check out my Cycle 3 video where I was using a Gonal F pen in that cycle. Okay, so that is what the Gonal F looks like, and I have 3 boxes of those. Yes, and I have some refills in case I need them, since I have 1 refill. Okay, so this bag has 3 boxes of Gonal F, and 2 boxes of Cetrotide. Alright, because this has to be refrigerated, so I'm going to put this back here in the cooler. I'll show you what the Cetrotide looks like. The second bag, blue bag, is all Cetrotide. There are 4 more boxes of Cetrotide. Is this Cetrotide? Yeah, 4 more boxes. 4 more boxes of Cetrotide in here. So I'm just gonna put these back in here to keep them cool. And then I'll open this so you can see what the Cetrotide looks like. So these all come with their own things, I guess. Yeah, so Cetrotide, I don't know why it has to be refrigerated, but either way. Alright, so this comes with this own syringe, so it's not a pen. So this syringe is filled with water, saline, sterile saline, and there's a powder in this vial. And basically there's 2 needles in here. There's a really long one and a short one. Let's see if you can see. This gray one is the short needle, and then this yellow one is the long needle. I don't know if you can see that good. Right? So the long needle is used to do the reconstitution. So basically you put the long needle on the syringe, you drop it in the vial and push the water in, swirl it around and get everything mixed up. Once all the powder is dissolved, you draw everything back up into the syringe, and then you replace the long needle with the short needle, and then I use the short needle to inject subcutaneously. So that's how that works. That's the Cetrotide, but I didn't even get to the Cetrotide yet. Alright, so I'm on the Gonal F for 5 days. I'm taking 150 IUs, and I'm starting with the pens. The pens are 900. They have 900 IUs in them, and I'm going to be using 150 IUs twice a day. So that's what, 300 a day. So I'll get 3 days out of each pen. However, on the same day that I start injecting the Gonal F, I will also start taking doxycycline. So that's these. We've got all my business on here. So that's the doxycycline. Medication should be taken with plenty of water. So I guess I better have some water. Alright, so the doxycycline, one capsule twice a day, AM and PM. So I'll be taking this when I do my injection, so I don't forget, since I'm doing that twice a day. Okay. Then it says in approximately 5 days after beginning the Gonal F. So this is where it gets a little wishy-washy, because, alright, so that's all the medicines that have to be refrigerated. Well, I'll come back to the Cetrotide in a minute, but this is where the Cetrotide comes in. So on day 5 of STEMS, I will go in for a follicle scan. So that's on Saturday. I will have a follicle scan, and he'll tell me whether I should start the Cetrotide. Okay, so I'm just putting this back because I want to make sure this stays cold. So I'll go in Saturday on day 5, because what's the day? Tuesday, so Wednesday, Thursday, Friday, Saturday. So that's only 4 days. I'm going to call and ask if they want me to take the meds on Saturday morning or wait. Since my appointment is at 8 a.m. I wonder if I should take, well, I'll bring the Cetrotide. Well, I don't know. I'll bring it with me. I'll ask if they want me to take the Gonal F or not. Because I'm a little confused now on whether I should take the Gonal F on Saturday morning. I'll call the office and find out. Anyway, once I start taking the Cetrotide, I take that between 6 and 8 a.m. So I take that 1 shot a day between 6 and 8 a.m. Now, once I start the Cetrotide, then I also start Minipure. which is also an injectable medicine, and it has to be mixed as well. This is also in a powder form. Doesn't have to be refrigerated. So, very, or I should say quite similarly, needle-free reconstitution. Interesting. So there's a powder, and then there's the sodium chloride, right, which is saline. Same thing as with the Cetrotide. You know, you're supposed to reconstitute. But, okay, here we go. So I've got a big bag of syringes to be used for the reconstitution. But this is needle-free. I don't know how this works. Let's see. Oops, sorry. Lost my light because my machine. So, there we go. Let's get the light back. Alright, so the Menopur, I'm supposed to take 75 IUs of Menopur. Menopur is pretty much the same as Gonal F. So, basically, vial adapter. So I guess I don't need a needle. I guess I reconstitute. Okay. So I guess I reconstitute with this little adapter thing. This I haven't seen before, so I'm gonna have to look for some instructions on how to use this. Or maybe there's some on the box or something. But yeah, so I just opened this for no reason because it all looks like this. But yeah, so I guess it's needle-free reconstitution and the Menopur. But I have a bunch of needles. That's probably what these syringes are for. These little syringes for me to do my Menopur after they've been reconstituted. So I use this little adapter to do the reconstitution. Mix it up, and then I can draw it up. But there's no syringe because these are just tops. These aren't syringes. So unless there's something in here, I'm telling you, I'm gonna have to spend some time organizing this stuff. But I think these are the other needles. So anyway, yeah, we'll figure this out as I go along because I don't see the actual syringe part that I'm supposed to use with that. So that's weird. Where's the actual syringe? These are just the needles. Oh, I guess I don't know, how is this supposed to work? Because this doesn't have any syringes. So this just has the vials. Interesting. Let me I'll figure this out. Because I have needles, but I don't have the actual syringes for them to go on. I don't have that. These here are syringes, but I think these are the progesterone syringes. Anyway, so once I start the Cetrotide and the Gonal F, my Gonal F drops from 150 to 75, and I take, at that point I'll be taking 1 injection of Cetrotide, which I think is like 0.25. I'll be taking 75 IUs of Gonal F and 75 IUs of Menopur. So, place the Q-cap on top of the water bottle. Take a 3 milliliter syringe. Oh, so I guess I'll use these. These have long needles on them. I guess I'll be using these then. I have to make sure I have enough. But this is a 3 milliliter syringe, so they'll take the 3 milliliter syringe and place the 27 gauge needle on it. So that's this 27 gauge half-inch needle to inject the Menopur. So at that point, I'll be taking Cetrotide, Menopur, and Gonal F. So I'll be injecting Menopur once a day, Cetrotide once a day, and then the Gonal F twice a day. So, the morning dose of Gonal F will be 75. I guess the evening dose will still be 150. I'll need to verify that. Alright, so then that will go on. I'll come into the office like I'm supposed to for pelvic ultrasound and blood tests to evaluate my response. And then I'm supposed to stop taking the baby aspirin on the 9th. Which is what day? The 9th is Saturday. Yes. Okay. Then from the 14th to the 27th, I'll be taking the methylprednisolone. That's these little tablets here. I think that's antibiotic. And then once my leading follicle measures 7 to 18 millimeters, I'll inject my human chorionic gonadotropin. That's the HCG. That is this vial, which looks like, he said it was Pregno, but this says, I don't know, it just says chorionic gonad. I think it's the generic, but this is also a powder. It has to be reconstituted. So there's the powder. It's in this little box. Here's the water. Bacteriostatic water for injection. And this injection here is intramuscular. So I'll be drawing this up in a 3 ml syringe. Okay. And reconstituting it. And I think 25 gauge. I think this is a reconstitution needle. And injecting it intramuscularly in the buttocks using the 25 gauge 1.5 needle. So this guy. Yes. Yes. He is long. So everything is subcutaneous up until the trigger. And that's the scary shot. Where this entire needle, oh, if you can see that, right? This entire needle, yes, it is long, will have to go in my butt. Good thing I'm a big booty girl. Hopefully it's enough needle to get into the muscle, because I got a big caboose. So anyway, there's some very specific instructions here. So, and these are all short little sub-Q needles. And I think they just give you a bunch of 3 milliliter needles with the reconstitution needle already on it. And then, you know, you use it however you need to use it. Or I guess it's not a reconstitution needle. It's just a big needle, 22 gauge. Eesh. That's a big needle. Okay, so if all goes well, what I mentioned earlier is that my retrieval will be on June 17th. And it says egg retrieval takes place about 36 hours after the HCG injection. I'll be told exactly when and what time to take my HCG, and how much to take of it. It says I can't eat or drink anything after 9 p.m. on the day prior to the egg retrieval. I'll show up in a fasting state out to the Vieira Fertility Center. I'll have to figure out where that is. There's no address here. And the procedure usually takes place first thing in the morning. Anesthesiologist will start an IV, which will be used for injecting medication for the sedation. Don't know if I'll be sedated because, well, my weight. So we were talking about just using local anesthesia instead of sedation. I don't know what they're going to do. I'm going to continue to work on my weight loss, but I'm not going to have my BMI under 35. So quite likely I will be under local anesthesia and there won't be an IV. So we'll see how that goes. But it says wear comfortable clothing and bring a light jacket. The recovery suite can be cold. And then these instructions also say on the day of egg retrieval, I'll start injecting the progesterone in oil. It'll be 1 milliliter intramuscularly into the buttocks once a day in the evening using the 22 gauge 1.5 needle. So that's the needle that comes in these. And 22, listen, these little sub-Q needles are 27 gauge, okay? The lower the number, the thicker the needle. Okay, this needle's thick. It's long and it's thick. Oh, my hands are so ashy. It's long and it's thick. I'm not trying to scare anybody, but I mean, you know. So that's once a day. And I have my progesterone here. And what they explained to me when I called the pharmacy is that this is progesterone in sesame oil. So as far as I know, I don't have any allergies to sesame. I love sesame seeds, so this will work fine. I'll have to find some way to heat it up prior to injecting it so that it's a lot looser and less thick, so it doesn't hurt as much. But I got 3 bottles now. He wanted me to have 4, but in case you didn't know, there is a progesterone in oil shortage going on. So the pharmacy told me that he asked for 4, but they were only allowed to send me 3 because of the current progesterone in oil shortage that's going on. I guess there are a lot of women out here doing IVF or doing assisted reproductive technology and requiring injectable progesterone because there is literally a shortage. So the pharmacy could not send me all that was sent. So when I get down to my last bottle, I'm going to call them and then they could send me more. So they could either send me the 1 or they can send me like 3 more. So we'll see how it goes. I have 4 refills, but it's 4 refills on 4. Again, they only sent me 1. So I actually have 5 refills plus 1 box. So that is everything. And it does explain embryos are transferred back into the uterus about 3 to 5 days after the egg retrieval. In preparation for the transfer, you must drink about 20 ounces of water. In addition, please take 1 pill of diazepam. Yeah, here's my diazepam. My 1 little pill. This is the volume. Right. That I paid $3.99 for. So 1 pill of diazepam. And the RE explained to me that the diazepam is not to relax me, but it's to relax my uterus. So, because I've taken Valium before, and it does nothing for me. Or maybe it just does nothing for me because I'm not particularly nervous for what they were giving it to me for. But he said it relaxes the uterus. So if it'll relax my uterus for a transfer, then I'll take the diazepam. And then if I have any questions, feel free to contact the doctor with the number. If I have any questions, call a doctor prior to mixing or injecting any medicines. And then, quite sweetly, it says, our prayers will be with you, asking for a positive pregnancy result. And then, please note the dates contained in these instructions and calendars are approximates and may change depending on the response of your ovaries. Okay, so it only took me 45 minutes. This is going to be a long video. It's gonna be like an hour long, but there you have it. There's my meds. I start taking it tomorrow, so I will check in with you guys. Probably not every day, but I will certainly check in and let you guys know how I'm doing on my stems. If you don't already follow me on Instagram, you can follow me on Instagram to get up to the date updates, because my videos here on YouTube are 2 weeks behind. So if you only want to follow me on YouTube and not on Instagram, that's fine. Just know that you won't have the most up-to-date information. Most up-to-date information will be on Instagram. Not that I want to spoil everything for those who are watching the videos, but I would say that it's best to be on both, right? So you get the most up-to-date information on Instagram, but I give you more detail on YouTube. So there. Alright, ladies and gents, thank you for following me. I am going to go get my meds here in the refrigerator so that they can stay cool and fine, because I can't even get this thing closed back. I don't even know how they packaged it. And then I am going to organize my needles and syringes and figure out exactly when I'll be running out of medicine, or at least try to figure out when I'll be running out of medicine, so that I know when to call a pharmacy to have them send more stuff. So, but that is my antagonist protocol. I am excited to get started. I'm so happy that I'll start Gonal F tomorrow. I am not nervous to start Gonal F because I've had 3 IUIs. All 3 IUIs included Gonal F. So I am quite familiar with injecting myself with sub-Q needles, so that I am not nervous about at all. The trigger shot will be a whole new adventure for me, but let's get there, right? Let's get there. And I just hope it all goes well, and I'm bracing myself for this next step. So this is a big deal, big deal. I'm glad I have the box here. So it is now 1:46. I need to start getting ready to go get my blood drawn. And that'll be it. And I'm starting. I'm so excited. I told the doctor I know I don't look excited, but I really am excited to be starting. So I'm sorry for the long video. I know the videos are long anyway. This one's going to be over an hour. But there's a lot of information here, and I'll, try to keep it short, as short as I can. But there are an enormous amount of ladies on Instagram that I'm following that are getting BFPs. Congratulations to them. Let's get with the stemming. I know there are a few ladies who are stemming with me in June, right about now. So hopefully we're all, I know there's a couple ladies, I think there are maybe a few days ahead of me. And so best wishes to everyone going through a cycle this month, whether it's IVF, IUI, or natural. Best wishes to you guys. And as Simply Tanika would say, let's get those babies. Let's get those babies. Ah! So excited. Today is the 5th. And I just want to shout out Sandra Wiley in 2 days. She is having her very first transfer. It is a frozen embryo transfer, but this is the furthest that she's gotten in her journey. So I want to wish her all the best and sticky baby dust and all that great stuff. So Sandra, I know this is going to be late, but just so you know, I was thinking about you on June 5th. I hope things go well. I know Simply Tanika is coming up on the end of her 2-week wait in real time, but in video time, she hasn't even had her IUI yet. But I follow her on social media, so I know in real time she's coming up on the end of her 2-week wait. So sticky baby dust and wishing you all the best there. There are a few ladies having baby Mac, the McCoys. They're 38 weeks, about ready to drop little baby Ava. So hopefully I'm praying and wishing you well. There's another woman, I cannot think of her name. I'll put it down here, but she is 40 weeks, has not dropped her baby yet. Wishing you well. I also follow, who else is coming up? They're coming up short on their time. Let me see, who else? Fruit Froze, she's nine weeks now. 9 going on 10 weeks. So her pregnancy is going well. She had her first craving. It was taco burritos. She wanted a burrito. I wish I could have a burrito. Keto, man. Oh, can I have a burrito? She said I could have a burrito bowl, but it's not the same without rice and beans, right? Single mother by choice. I'm thinking of you. I didn't check on you today. But I hope you are still baking, baby girl. I'm going to check on you after I'm done recording this. So hopefully baby girl is still baking, or that you were able to go home yesterday. I need to check on you and see what's going on. But hopefully she's still baking and we can get another few weeks out of there. And at the lake, I'm following her. She's coming up. I think she's about her last video, she was, 32 weeks. So she's coming up pretty soon as well. And I'm trying to think, who else am I watching that is pregnant and about to drop? It's like baby season right now. And so yep, I think that's it from all, I'm all up to date on my videos here. And I am just looking forward to my journey. So I just wanted to shout out a few folks because there's a lot going on. There's so much going on right now. And I want you guys to know that I do watch you. I try to comment as much as I can, but I don't want to keep repeating myself and saying the same thing over and over. So sometimes I don't comment, but I do absolutely watch. I keep up with all you ladies. I'm totally obsessed. Totally obsessed. Tasha, take a time out. I don't know, from your last video, I don't know if you're still with Mr. B, Bear. I don't know if you're still with him or not. It sounds like you are, but maybe not. I don't know, girl. Hit me up in the comments and let me know and fill in my confusion. I should have commented on your video. I did not comment on your video. I will comment on your video and ask, because I was confused at the end whether you were still dating or not. No judgment. I'm just trying to work it all out in my head. By the time this airs, hopefully I'll have an answer. But again, thank you, ladies, for following me. Sticky baby dust to all those TTC. And let's get those babies. It's Baby or Bust 2018. And I am chugging away. And can't wait to get started with this process and make it through retrieval and send them off for PGS testing and figure out what options I have after that. I'm totally excited. So I'm gonna go because it is now 10 minutes to 2. I need to get something to eat so I'm not sitting in the lab starving and tempted to get McDonald's or Taco Bell because these are all around the lab. So I'm going to go get me something to eat and try to figure out the rest of my day and contain my excitement. Woo! All right. Talk to you later. Bye.